Cassidy.
Hey, Dr. Bertagnolli. I got lots of questions, so if I interrupt you, please be tight with your answers, and if I interrupt you, I apologize in advance. You said during your staff interview you support the reasonable pricing clause included in the recent contract with BARDA, but you were not familiar with the NIH experience in the 90s. Clinton administration NIH Director Harold Varmus stated when rescinding the policy, extensive review indicates that the pricing clause has driven industry away from potentially beneficial scientific collaborations, and eliminating the clause promotes research that enhances the health of the American people. Research America, an alliance of hundreds of organizations advocating for biomedical research, expresses concerns about the policies that would, quote, discourage the uptake of breakthrough discoveries by the private sector. This would be detrimental to patients. Would you apply reasonable pricing clauses to NIH contracts if confirmed?
So, Ranking Member Cassidy, my absolute utmost priority would be securing effective treatments.
Now, that's not my question.
Affordable.
My question.
So,
would you apply reasonable contract pricing clauses to NIH contracts?
I cannot commit to any specific action at this time.
I'm asking you to commit to not an action.
But I will work with you on this issue because I share your desire to make sure people have access to the treatment.
Well, of course, my concern is, based upon Dr. Varmus's experience, that if you do institute, you're going to stop the translation of basic research to taking care of patients. This is not something that we need to kind of pussyfoot around. History tells us that if you do it, patients are damaged, despite whatever rhetoric would be out there. So I hope that you would be more forthright in your kind of embracing this issue. We've got scientific evidence. My gosh, if we're doctors, we should actually look at the evidence, not listen to the rhetoric. I say that because I know that patients are going to be damaged by this, and that should be our highest calling. I don't mean to rag, but I just get frustrated. Okay. Also, what about march-in rights? You mentioned that you want to lower costs. People argue for march-in rights. Your predecessor, Francis Collins, consistently said during his tenure that the NIH does not have authority to use march-in rights to lower drug prices. It goes against congressional intent if you only use it to lower drug prices. Do you support using march-in rights to lower drug prices, quote unquote?
Again, Ranking Member, I cannot commit to any particular policy right now. And
now that is, though, it specifically says in the law that you're not supposed to use it. It gives you 3 ways to use it, and one of them does not include lowering drug prices. I mean, we're just asking you, are you going to follow the law? That would be the action.
I will follow all the laws of our land, certainly. And again, my goal will be to make sure that people get the treatments that they need.
Sounds good. Sounds like, with that answer, it sounds like you're answering my previous question that you wouldn't do the other thing. Let me ask you about another issue. Secretary Becerra chose not to continue an NIH Ethics Advisory Board reviewing extramural fetal tissue research for appropriateness during the previous administration. And presumably a panel like this would help achieve what you tell me your preference is of ensuring fetal tissue is only used as a last resort. I am told there were members of this board who supported fetal tissue research, but still rejected some of the research projects put forward by NIH for the board's review because of a lack of informed consent. Now, you stressed the importance of informed consent in an earlier answer. These pro-fetal tissue advocates rejected these proposals because of the lack of informed consent, but Secretary Becerra has discontinued this board, providing that safeguard. Do you agree with Secretary Becerra's decision to not continue this board?
Senator, I do not have enough information about those specific actions to really comment on Secretary Becerra's decision. What I can affirm for you is that any research needs to be conducted according to the most stringent ethical principles.
I accept that, but this board was making sure that was the case, and it rejected some of those. It was the mechanism by which what you were telling me was actually executed. The informed consent was not done. If we stipulate as a theoretical that what I laid out the facts are correct, would you support reinstituting the board?
Again, I can't comment on the specifics of that activity. I can just say that if confirmed, I will uphold the principles of ethical human research.
It's been 4 years almost since the COVID-19 pandemic began. We still actually don't know where the virus originated. Many studies and reports have explored plausible alternatives. Experts agree that further research is needed. Do you believe the federal government should do everything it can to determine the cause of COVID-19, including the possibility it emerged from a lab that was conducting gain-of-function research?
Ranking Member Cassidy, I think no one wants to know what the true origin of the last COVID pandemic was more than the biomedical
And how will you
research
accomplish
community.
that?
To the fullest extent of our ability to gather the data and have access to the data and make a valid assumption.
And making it public?
Make data that we have available public and accountable to the American people, yes.
Okay, I yield.